Here at International AIDS Awareness Day, HIV, and making education. What we're about to do now is kind of give you an example of what we go through. I'm talking to Brent Pendleton, Prevention Supervisor at the Montrose Clinic. My name, of course, is Smiley Maddox. I want to thank you for continuing to pay attention and watching. We appreciate it, and hopefully you'll learn something for it. Brent, this is about to be your show here in a second, so why don't you go ahead and walk us through what you're about to do.
Okay.
Here I am.
Okay. One of the first things that we do at Montrose Clinic is, even in the community outreach prevention services, is that if somebody wants to get tested for HIV, we ask them to fill out a simple questionnaire, and it's very, very easy. It's some basic demographic information about where they live, how they choose to identify, what their racial or ethnic background is, if they've been tested for HIV before, and how often they practice safer sex. Smiley's already filled one of these out for me, just to show you how easy it is. We ask you what type of sex that you have. If you have oral sex, you have anal sex, vaginal sex. If you're having sex with men or women, there are drugs involved. We also ask some other questions about if you ever had sex with somebody who's HIV positive, ever exchanged sex for drugs or money and things like that. And it's a private, one-on-one, confidential setting. I cannot publicly test and have a counseling session with you. I cannot give you results on air because Montrose Clinic is based on confidentiality and keeping everybody's business between the counselor and the client themselves. So it's very simple. It takes about 5 minutes to fill out this form, and then you also sign, when you're in with your counselor, you do sign a consent form, and then you get a results form as well. Okay?
So now the form's very, like you said, it's confidential. It's not public. It's private. It's one-on-one.
Mm-hmm.
And so now that we've gotten all the paperwork done, it's me and you in a private setting. It's generally in a room where you know no one's around, so no one's going to hear the results. No one's going to hear the answers to my questions. What's next? What are we about to? Of course, I've done this before. So, but you know, for the listeners and viewers out there, I'm going to have to sit there and talk to. I know people out there can see what's going on. But for the people that are listening now on KPFT, I'm going to actually talk. So you're putting gloves on, and you know, so go ahead and.
Normally, what I talk about right now is I just talk about when was the last time you got tested. I talk about ask you some questions like what type of sex do you have. One of the misconceptions, especially with youth right now, African American and Latino youth, they don't consider oral sex and they don't consider anal sex as sex unless they're having vaginal sex. So those types of sexual contact is considered sex. So we talk about your risk. We talk about if you talk to your partners about HIV, if you use condoms regularly, those types of things.
So you're opening up a package, kind of a full package that has Oral Quick Advanced on it. Who came up with that? I mean, you know, how accurate is this test? I mean,
this is 99.8% accurate. That is the accuracy rate on this test. So it's only a 0.2% chance that it would be either a false negative or a false positive. And we always do confirmatory testing as well.
No.
This is basically testing you for the antibody that causes the HIV virus. And then if this comes back reactive, what we do is we will do a confirmatory test to actually, it goes in and looks for the virus itself.
Okay, so you just opened up a vial container of liquid.
That is the solution, the testing solution that actually activates it.
It. So, okay, so now we've opened up the package, and what do we do next?
Clients have two choices. It's up to them. This is the Oral Quick Advanced, which actually will do either an oral swab or a finger prick. You have the option of taking this paddle right here and actually putting between your gum and your mouth, like that, and then I stick it in the solution. Or I would take I would prick your finger and take a drop of your blood and put it in the testing solution, and in 20 minutes you'd have a result.
People can actually see how easy that is. You know, I mean, can someone buy this over the counter? I mean, no.
It's currently not available for FDA use.
Is there any over the counter at home AIDS test? I mean, I've vaguely heard some rumors about that. Is there anything like over the counter someone can buy?
You can buy the home testing kit. The only thing is you have to send it away for testing, and then they send you a result or you call back. Well, I can't stress the importance of how important it is to actually speak with a counselor. Okay, having that one-on-one conversation with a specialist, risk reduction specialist, a trained HIV provider who can actually talk about your risk, get you to open up a little bit and ask some questions that you may be afraid to ask. That is the most valuable part of testing, is the counseling session. It's not just the 20-minute in and out.
So now we've got.
You want to do the finger prick?
Yeah, we're going to do the finger prick
Because
because
the oil is
the
very
oil,
simple.
the oil
All
is
you
very
do is,
simple.
like,
Yeah,
put
it's
it
like
here,
brushing your teeth.
in there, and it's done.
And yeah, inside the container. But the pinpricks, people are, you know, this is something that's, now both are just as accurate, but we'll actually show that the pinprick is not painful at all. It's,
Not
so you're
painful at all.
swabbing
your finger right now with alcohol.
With alcohol.
Make sure it's clean. I'm going to put one of these sterile lancets on a lancet gun right here. Make sure you see it's sterile.
Yeah, it's sterile. And a little needle comes out.
Well, not yet.
Not yet.
I got to take off my little safety cap.
Okay.
And then what I'm going to do is I'm just going to press a little bit here on your fingertip, and I'm going to take my testing lancet right here.
And that was it.
That was it.
And I mean, it felt like you rub your feet across the carpet and you touch a doorknob, a little spark. That wasn't even it.
And I just hold that right there. What I'm going to do now is I'm going to take this collection loop and I'm going to actually collect the little drop of blood that I have in your finger.
Right there. I mean, that's not even and that right there is just enough. So you barely just swab it with a kind of a plastic
That's all I
loop.
have.
That's it.
You drop it in there.
Drop it in there.
Stir it up.
Throw that away.
I'm going to take care of your finger first.
And I mean, you know, that was just less than a minute.
Yeah.
And so now the results will come back in about 20 minutes.
I got to put the paddle in first.
You gotta.
Yeah, I haven't put the paddle in first. I first want to take care of the blood on your finger. I'm wearing gloves, so there's no risk or anything like that involved to protect you and to protect me.
And now I have a nice little Band-Aid on my middle finger.
Okay. Throw that away, and now I'm going to take the testing paddle. I'm going to put that in there, and it's going to cook. We call it cooking. It's going to cook for 20 minutes.
Okay, so we're going to have that right there, and it just sits there for about 20 minutes. The chemical works, and I mean, you know, that's how easy it is. On a regular basis out there, how many times I can sit down?
Don't forget your condoms and don't forget your lube too.
Oh,
that's very important.
Thank you. Well, I'm gonna use these. Well, I'm gonna use the lube tonight. I don't know about this.
And there's some brochures on HIV and on the test that you actually took as well.
These you pass these out with everybody. With STD facts, sexual transmitted diseases. The Oral Quick Advance. This is the information that we just went through, and then HIV facts. So very informative, very shareable. I'm going to stick that with the rest of my paperwork. And what I wanted to ask was, someone that is HIV negative, how often, depending, I guess, on their sexual behavior, how often should they get tested?
Well, it's funny that you say that, you know, for somebody who's HIV negative. A lot of people claim that they're HIV negative. A lot of people talk about that, but they don't know unless they test. Just because you were HIV negative a year ago doesn't necessarily mean that you're HIV negative now as well. I suggest people that are sexually active get tested every 6 months, and if their activity is even more